Hi, I'm Charlie Goldberg. I'm a professor of medicine in the Department of Medicine, Division of Hospital Medicine at the University of California, San Diego School of Medicine. And I'm the executive director for faculty development. I'm excited to present the first in a series of educational videos focused on AI. We're calling this series A.I. Ay-Ay, in recognition that this is a fast-moving space and we have a lot to learn about it. Um, I should offer up front that I am not an expert in AI itself. I have expertise in medical education. I'm AI curious, sometimes AI intimidated. And I think I can leverage that in a good purpose in the world of medical education. Like a lot of faculty, we see AI being used in many different ways across our clinical arenas and also in medical education. And it's all happening so fast, it can be so overwhelming that it can be hard to find an on-ramp. What is the best way of beginning to explore or exploring in a best practices sort of fashion the integration of AI in teaching and learning? And it's really that's the focus of these videos. What do we gain from integrating AI and from our learners integrating it in the various ways that they are? And what are the risks and the costs? Because at the end of the day, AI is a tool. It's something that can be used in the service of achieving whatever ends we need to achieve, whether they're clinical and research or specifically in the teaching and learning space. It's neither inherently good nor evil. It is just something that we need to understand how to use in the best possible way. And that's the purpose of these videos. One challenge when you hear from experts or you go to symposia, everyone is so informed and so positive about everything. It's hard to know what that means for you. So these videos are explicitly designed to give you bite-sized aliquots of the information that you need about AI in a real-time way. And they're going to be done as a dialogue between myself and UCSD faculty who themselves are using AI in various ways and formats. And by using familiar and dialoguing with faculty who are familiar, hopefully that will make this whole conversation more accessible so that you can be AI informed and you can be intentional about how you're utilizing it in your teaching and learning. Your learners are definitely using it right now, or many of them are. Not everyone, but many of them, and many of you are using it. And it's happening so fast that the dialogue about how to use it best, what it means in terms of medical education, is lagging. And what we don't want to happen is a year, 2 years, 5 years down the road, look at our learners and ourselves and wonder, how did we get to this place? Did we use this tool in the best way possible? What were the best practices? And how do we integrate it into everything we do to continue to produce excellent physicians who are fully capable and empowered to do all that's necessary to not only take care of patients, but to teach our learners and to learn alongside them as we journey through the healthcare experience. So without further ado, I'm really pleased to introduce the first discussant, Dr. Samir Gupta. Samir actually, it was based on a conversation we had in the hallway that made me recognize that there might be a real use for this kind of podcast. Samir is professor of medicine in the Division of Gastroenterology, and he's going to focus this first podcast on the initial dialogue that he has with his teams when he's working as a consultant in the GI space. So, Samir, thanks very much for your willingness to share, to talk, to go on this adventure with us, and to discuss the sort of how and why I do it tips. So, tell us just as an introduction who you are, where you work, what you do.
Thanks, Charlie. As you said, I'm a gastroenterologist. I spend um, probably 60, 70% of my time doing research on colon cancer screening and prevention. And then the balance is taking care of patients and teaching. Um, Most of the teaching I do is with fellows, helping them learn how to do procedures, evaluate patients. I do some consult service. And then on the consult service, I get exposed to medical students and residents. And then, of course, I also mentor a lot of students, residents, and fellows in research. So I have a lot of interactions that way as well.
Great. Tell like what I would describe as your AI journey. How did you get comfortable with it? How much are you using it these days before we get into the GI specific stuff?
Yeah. I by no means am an expert like you. What got me experimenting, I think, is I'm hoping I have at least 15 or 20 years left in my career, and I have a lot of anxiety about being left behind. And on the one hand, what are the opportunities to leverage AI to be a better doctor, a better researcher? There's a lot of promise, a better teacher. And also, if it is what they say it is, if we don't learn how to use it, we will be left behind in all of those domains that we care about. So that is what has motivated me to try and experiment with using it in my work and also trying to read about it. Um, uh, find some resources basically to read about it and get some structure around what I'm doing.
Makes sense. Sounds like it's probably emblematic of how a lot of faculty are thinking about this area as it's growing so dramatically. When you meet with your team, when you're the attending on a consult service, you're on for a week or so.
Yeah, a week or two at a time. Yeah,
What is it that you put out there for your first day?
yeah.
Be transparent about AI, et cetera.
Yeah. So this is a work in progress. I'm definitely experimenting with it. I think the kernel of this idea came from a, a panel discussion I heard Davey Smith participate in which he was talking about AI on the console service. But what I've started to do on the first day, in addition to the usual orientation, is to say something to the effect of, I use AI for different things. I know you all probably use AI. And I'd really like for us, when you're using AI, to share so that we can learn about how we're using it. And the idea here is I really want to normalize the idea that people are using AI. And then it's really important to me, um, both as an educator and a learner, for me to understand how people are using it so that as a teacher, I can try and help pick through when the use is appropriate and optimal and when it may not be. There's obviously we make real-time decisions about things that team members bring to us. We tell people to look stuff up and they bring information back and we make a decision about a treatment or not doing a treatment based on that. So that the stakes can be significant. Um, so I think it's really important we know where the information is coming from. And then as a learner myself, I'm open to learning how, whether it's a student resident or a fellow, what are they doing? Because they may be onto things that I haven't experimented with or that I don't understand or approaches. And so that's an opportunity for me to really learn from them.
How has this been received? What do the trainees say about it? Is it unusual? Do they say anything that, wow, you're one of the first people to bring this up, or is it a good springboard for the week?
Yeah. I don't think I've had enough opportunities to know for sure. The first couple times it's sort of gone over fine. And I felt like um, the, everyone was willing to engage in a conversation about how they're using it. And I found that helpful for level setting. I mean, I had um, one medical student share with me that they use OpenAI, they look something up, they use that to help find references, and then they chase down the references, and then they use that for their learning. And I had another one share they look it up in open evidence, and that if it looks pretty good, they go with it. And um, I want to be careful about criticizing, one approach or the other, but it's pretty clear, like that second approach, um, you know, does the student understand the limitations of what they're seeing and the strengths of it? And then likewise, again, I have anxiety about do I understand the strengths and limitations of when they get an OpenAI generated output, what's good about it and what I need to be picking through more carefully. So I appreciated the transparency about it, and I hope if I can encourage the transparency that um, you know again we can start to work through where there's appropriate and optimal use, and then also where um, uh, people might be missing out on a learning opportunity or where there might be a clinical care issue too.
No, I can appreciate that. And again, it's one of the many caveats that are offered with AI is it offers potentially great information, but you have to do the checking and the due diligence yourself to make sure it actually makes sense. And certainly, for any of us in medicine, we're viewed as experts as we should in our field. You're viewed as an expert as in gastroenterology. Other physicians are asking you for your input. So being sure that the information you give aligns with what's actually known seems really important. Um, have you seen any or encountered examples where some of the pitfalls associated with AI have become apparent?
Um, there's observations, and then I would say like the theoreticals that I think I'm worrying more about as I learn more. So some observations, for example, um, I can think of a scenario where we review e-consults, and the fellows will do the e-consults and send them to the attending who's assigned, to review that. And I recall one experience where the fellow generated a response where I was like, oh, this is kind of something new. I thought I knew about this area, and maybe they've found like a new paper or something. And I went to talk to them about it, and what they explained to me was they had a prior recollection of what they thought was true based on their learning, and that they had used AI to sort of confirm what they thought was true. And because it confirmed what they thought was true, they went with writing that up in the console. And the topic was more nuanced, and we had a conversation about it, and I just encouraged them, as you were just saying, like um, as a fellow, they have to learn how to become an authoritative expert in the field. And um, that's why they're asking us questions. So we really have to force ourselves to learn the ground truth and sort of do the work of seeking that out. And how in this situation this kind of led us astray. Um, in retrospect, even just thinking about that issue now, it's really possible what response you get is also depends on how you ask the question within AI, right?
Yeah.
If you put in a prompt that's really seeking to confirm something, you make a statement, hey, I think this is true, am I right? It's going to be more likely to want to please you and say, oh yeah, you're right. Here you go. Here's the evidence to back up what you're doing, as opposed to if you ask a more open-ended question about, what's the evidence around this question, show me the range of responses. So that was that experience. And then maybe, just for a moment, there are two books that I've found helpful, I think, in creating a framework. So one is not targeted to medicine specifically, and my probably my wife tipped me off to this from another colleague, Co-Intelligence by Ethan Mollick. And I found this book useful because it kind of gives a broad framework of the different ways in which AI is positioned to affect our lives. And it includes some significant chapters there about education. So I found that helpful. And I don't know if there are better books. It's just the one I happen to read, you know. And then the other one I just finished is Giant Leap by Bob Wachter. And again, I don't know how many there are out there about healthcare, but one of the things I found helpful in that was like a whole, and I have some notes on this, was, again, a structured discussion of how AI might impact healthcare, strengths and limitations. And one of the things that I made a list of were limitations that I feel like, especially if we're using this in medicine, like these are like terms and definitions that I think we should all sort of be able to know. So like we got to know in context, for example, of using open evidence, like you, uh, what's the potential for hallucinations, bias, drift, um, misinformation, disinformation? How could using this de-skill you? Um, how does this, could it be subject to some kind of absurd responses that you might go with? And um, I still can't, off the top of my head, define each one of these. But when I read them, what made me start to think of is how I feel like as an educator, and especially when the stakes are really high, they're trying to learn medicine. Um, we need to make sure that the learners are aware of the strengths and weaknesses of the tools they're using. Just like we might talk about a textbook or a journal article or a review article or a case report. I feel like we have to have a vocabulary and a common understanding and engender a common understanding of, what these potential limitations are.
No, that's great. So many important points there. And I guess as we grew up with the internet revolution and we had to become comfortable with what's a good website because they all look credible, but they don't all have great information.
Right.
And the AI is just the latest thing and we're on a journey with it. And I love that, this notion of us all being continuous learners is relevant not just for our domains, but now for these tools to manage the mastery of our domains.
Yeah.
And I can imagine if you were not transparent with your team and didn't bring up the fact that we should discuss how your information was gathered, an important teachable moment could have been lost. And
Yeah.
if people don't, they may hear stories, you could read about something, but you're probably most impacted by what you see and the practice that you're exposed to and how you might then how that's modeled for you. And when this level of transparency about AI is modeled by faculty, I think it gives people appropriate pause coupled with enthusiasm. So wonderful in so many ways, Samir. Any other final thoughts?
Charlie.
Anything you want to add?
Um, you know, uh, I think I'd love for, I'm trying I'm looking for any opportunities for us to um sort of develop a common set of stuff that we should all know about. And I know we can't learn it all at once, but again, just as I feel like, we have a pretty good idea of like, hey, what does the average GI fellow need to learn in first year? Or the average intern, what they need to learn. Or the average faculty needs to learn about, the first year of being on faculty. I feel like I mean, even if we just limit it to medical education, what is that common core stuff that like we just all have to know, or all have to keep a pulse on. I'm really interested in understanding that, and without necessarily wanting to be any kind of like, master of it. Um, but yeah, I'll just kind of put that out there in case there's a response from anyone who watches this
Sure.
about that. Yeah.
No, that sounds great. It's a great point. I think a great place to end this excellent conversation. And hopefully this can be part of, the ongoing tools that people have to help think about this new and exciting entity that is well upon us, and it's going to be part of what we do and how we learn. Thanks again, Samir.
All right. Of course. Thanks, Charlie.